So I've just received report. I'm gonna go over my doctor's orders and then I will go in and see baby Carter and mom Layla. So I'm just gonna verify the doctor's orders. When checking the doctor's order, you're just gonna wanna make sure that any medications that are ordered are gonna include the patient's name, the time that you're giving the med, name of the medication, the dose, and the route. Perfect. So we're going to be doing a vitamin K injection, intramuscular per the protocol. All right, just some routine newborn orders and daily weights. There we go. Okay, perfect. That was written recently, so it's the right time. We're good on that. All right. So baby Carter weighs 3,900 grams, and if the dose is greater than or equal to, or if the weight is greater than or equal to 1,500, you're going to do 1 milligram. So he'll be getting 1 milligram of the vitamin K. Perfect. All right, so I'm just gonna, in the med room here, get ready to drop my medication. Right, so when I select the medication, I'm going to compare that onto the marm, make sure that labels match. It does. And I'm going to check the expiration. Looks good. So it's safe to proceed. That's my first check. Then I'm going to go here. I can put on my gloves. So with any medication, in order to administer it safely, you're going to want to go through the 10 rights of a medication administration. So the right patient, the right medication, the right dose, the right route at the right time, being given for the right reason, the right evaluation or assessment, the right patient education, the right documentation, and the right to refuse. All right. So I selected the 1 milliliter syringe, and the concentration is 1 milligram per milliliter. He's getting 1 milligram, so we're going to drop the entire contents of the vial. Just going to get this ready. Okay, that's ready to go. So then again, before I break the ampule, I'm going to compare it onto MAR. Vitamin K, vitamin K. Perfect. So I'm going to want to first tap any liquid out of the neck of the ampule. There's none. Then I'm going to clean it for 30 seconds. We'll pretend 30 seconds has passed. Great. And I'm going to put on the safe cracker. Break away from my hands. And I'm going to use this filter needle to drop the medication, making sure not to touch the rim of the ampule with the needle. I'm going to slowly withdraw the contents. And then I'll tap any air bubbles out. gonna need a little bit more. And then I'm gonna take my ampule to 2 other nurses because I'm just a student nurse. We need 2 independent checks. Provide them with the order, the ampule, let them make sure the calculation is correct. Check my syringe. Perfect, have them initial. And then I can now remove this blend fill filter needle, selected a syringe that is 25 gauge and 5/8 of an inch in length. I'm also going to want to label this. Right, perfect. You can dispose of my garbage. And then, now that I have my checks, I'm just going to do my 3rd and final check at putting away, checking the name with the order. Perfect. All right. Now I'm ready to go in and meet my patient. Right. Well, hello, my name is Rachel. I'm a student nurse and I'm going to be taking care of you guys today. How are you doing, Mom? Good. I'm glad to hear everything is going well. Baby Carter seems to be doing well. Excited to have him here with you. Yeah, of course. Right. Well, how has feeding been going? Good. Awesome. He's breastfeeding. Okay, and you're finding that that's comfortable. He seems to kind of have that rooting reflex, and you're kind of learning his hunger cues. Awesome. So you're kind of, he even told you want to be feeding a newborn kind of like every 2 to 4 hours. Kind of the more frequently the better, especially at the beginning. Awesome. And has he peed or passed his meconium yet? The meconium is just what we call poop, basically the first poop. All right, not yet. Right, so you're just gonna want to make sure when you're doing his diapers that you have a thick layer of Vaseline kind of all on his bum just to protect the skin from that sticky meconium because it can kind of be really tough to get off. Right, perfect. So I'm basically just here to do a routine newborn assessment on baby Carter, and then the doctor has also ordered a vitamin K medication to be administered. It is given through an intramuscular injection, and we basically use it for all newborns because newborns don't have adequate levels of vitamin K in their body at birth, and vitamin K is kind of like a building block that's needed for the liver to produce clotting factors. So without it, they're at really high risk for vitamin K deficiency bleeding, and like any little, like a bump, or if baby was to kind of fall, or even sometimes during birth there can be trauma, and then because they don't have the clotting factor, it's a really high risk for bleeding. All right, is that something that you'd be willing to consent to? Yes, great. So I would just ask mom to provide me with his name and birth date, and then double check that using her armband against what's on the MAR, or check his little toe here. Perfect. Okay, I'll wrap him back up. All right, so I'm just gonna start by kind of checking him over head to toe, and then we'll do the injection at the very end, and we can get you doing skin to skin or something after. Sound good? Perfect. All right, so I'm gonna start just looking him over. His color looks good. He's nice and pink. Just take off his little hat. So then I'm just gonna kind of feel around the head and make sure there's no bumps or bruises. I'm also going to look for kind of symmetry, not only in the head, because sometimes it can kind of become like molded or elongated in certain areas in a vaginal birth. And I'm also gonna look at the eyes in line with the ears, the nose, eyes and lips symmetrical. Yes. I'm just gonna assess the fontanelles. So this one at the back is the posterior, closes around 2 to 3 months of age. And then this one at the front is the anterior, and that one closes around 9 to 18 months. You would definitely want to provide some education, just that you want them to be kind of like soft. You don't want them to be sunken in, because that's a sign of dehydration, but also you don't want them bulging, because that can signify intracranial pressure. I would also want to tell mom that although you want them to be soft, if the baby's crying like vigorously, he's really upset, sometimes they might bulge out just a little bit, but that's normal. It's just a concern if it's kind of like during a period of inactivity and then it's kind of bulging out. Okay, I'm gonna also look at the eyes and ears for drainage. Make sure there's nothing in the nose. Looks good. Gonna look in baby's mouth. Oh, he's sucking on my finger. Just gonna make sure that the mucous membranes are moist, everything's intact. And then also, because of the high risk for jaundice in newborns, I'm gonna just look at the eyes, make sure the sclera are nice and white, which they are. All right, so now I'm just gonna unwrap him. And again, his color is really good. He's nice and pink all over. He's warm. He has good flexion in his extremities. It's kind of classic newborn presentation with the bent knees, bent elbows, clenched fists. I'm gonna just check his skin turgor. So you just pinch centrally. Make sure that it's nice and brisk. So it's a sign that he's well hydrated. And also capillary refill. Make sure that the color returns less than 3 seconds. Looks good. All right, now I'm just gonna have a listen. Okay, just going to listen to his apical heart rate for a full minute. Wow, and it's already been a minute. His heart rate is nice and strong, regular. I do hear a slight murmur, but that can be because at birth the ductus arteriosus isn't quite closed. So you get that little bit of extra sounds. Within a few days, it should close. And that sound would be gone. I'm also going to listen to his respirations. those are nice and easy. He doesn't look like he's using any accessory muscles. There's no adventitious sounds or anything like that. His respiratory rate's a little bit fast, so something to keep an eye on, but his color's good. It looks like he's perfusing well, so nothing to be too alarmed about. And then I'll listen to his tummy, take a look. The abdomen looks nice and rounded. Perfect. All right, awesome. There's bowel sounds in all 4 quadrants. No palpable masses, doesn't seem to be any tenderness. So now I'm just gonna look at the umbilical area, look at the cord, see that there's no bleeding, there's no active signs of infection, heat, redness, swelling, discharge, or odor. I would want to educate the parents about that too. Also about cord care, the importance of keeping it clean and dry. Like during the bath, it's okay if it gets wet, but you don't want to fully submerge it. Also going to let them know that with the diapers, you want to roll down the top of it so that it's not irritating it. And then it should gradually kind of turn from like a yellowy to like a brown to a black and then fall off. They don't need to pick it off or anything like that. Awesome. Okay, there we go. This area looks good. I'd want to teach the parents to make sure to point the tip of the penis down so that it doesn't get, so that like the diaper doesn't spray up, leak out. And then also check his bum. You know, Mom said he hasn't passed his meconium yet. Just make sure everything looks good. Yes, really emphasize the use of that Vaseline. And as this is their first baby, also let them know about the changing color strip on the diapers because it's super handy. It only changes with the pee, and kind of help them with that. Right? Yeah. Everything looks good. Baby's alert. Okay. And just because his head circumference is fit outside of the normal limits of 33 to 35 centimeters, I would, in actual practice, get the head circumference tape measure and measure. All right. And I'm just going to do the temperature now. Babies aren't usually huge fans of this one, so we like to save it until the end. Put the probe on. Perfect. And then I'm going to hold it shut. Oops. All right, 37 degrees. Awesome. Okay. So now I'm going to wrap baby up, just leaving the one leg exposed. And then I'd ask Mom to hold him if she's comfortable, just because needles can kind of sting, be a bit painful, and having Mom there or Dad can be quite comforting. Right. Oh, wrapped it a little bit too high, I guess. Okay. So this is an intramuscular injection. I do it into the vastus lateralis. So for landmarking, you divide the area into 3s, and then you're going to do it on the outermost middle section of the thigh. Okay. So before I administer it, I'm going to want to ask Mom as well, does baby have any known allergies? I mean, he's only a couple hours old. It's really unlikely, but it is something that you want to check. and it's important for safe medication administration. Maybe Carter doesn't. All right, so now I'm just going to kind of stretch the muscle taut, and then I'm going to clean in a circular motion for 30 seconds. And 30 seconds. Great. Now, right. So I have my needle, going to inject at 90 degrees. And I'm going to stabilize it, push it in slowly. And then hold for 10 seconds to prevent tissue damage. Now I'll smoothly withdraw the needle, release my grip, cap it, properly dispose of it, then place some pressure over the area. Let mom know, just like for about 5 or 10 seconds. Baby Carter handled that really well. Perfect. They don't usually bleed. And now we'll get them all wrapped up. And hand it back to mom to do either skin to skin or some breastfeeding. Do you have any questions, mom? No? Okay, great. I'll be back to check in a bit.